very, very common reason for lameness in dogs is something called a cranial cruciate tear. I've actually had 4 of my own pets have this, so it's that common. Basically, it's an ACL tear in humans. Typically very young, active dogs, middle-aged active dogs, but they're typically ones that are running around, galloping around, and they will acutely come up lame. If that happens, see your veterinarian. Basically, the cruciate ligament is your supporting ligament to your knee, is the best way to put it. And if it's no longer there, they lack support. It also causes extreme pain. This is a knee on a dog. Basically, this is the femur and this is the tibia coming down. Your cruciate crosses from front to back, and it keeps me from being able to, and this is the kneecap, I'm peeling it away, it keeps me from being able to shift these bones. It gives us support. So as your dog walks and steps, that keeps these bones from shifting. When a dog tears a cruciate, we can move it here, and you shouldn't be able to get that motion. So as you can see, if a dog has a torn cruciate, every time they step, this knee jerks forward and it takes away the stability. So typically you have to go in and do some sort of form of surgery to give the dog stability its back. When you see your veterinarian, they're going to diagnose it usually just by doing an exam, and then they're going to offer you a couple of varieties of treatments. Small dogs sometimes don't need treatment, but just time. They are so small that they don't need that support as much. But once you get over a certain age dog, then you're going to have to discuss treatment options, and there's 2 surgical options for it depending on the size or the activity level of your pet. If they come up lame, and the other thing that's important is about 60% will blow the other cruciate in the other side. So it's not that I'm saying don't let your pets run and play, but if you see an acute lameness in your dog, you do want to see your veterinarian, because you probably are going to have to have some surgical intervention. It might be a good reason to consider insurance in pets, because it's not the cheapest surgery in the world, and it is so common. We see this every single day in the clinic. So just kind of keep in mind, if your dog comes up acutely lame, you want to see your veterinarian to see what the reason is, and it does also require pain control, which is part of the treatment plan.